Lung cancer is the deadliest form of cancer. About 1 out of 4 cancer deaths are from lung cancer, but there are natural remedies that you can use to prevent it. So in this video, you're going to learn about the symptoms of lung cancer and what it is, and then you're going to discover different lung cancer causes and how to fix them. So let's start. Lung cancer is the uncontrolled growth of abnormal cells that start off in one or both lungs. So there are 2 main types of lung cancer: non-small cell lung cancer and small cell lung cancer. So non-small cell lung cancer accounts for 80% of lung cancers, and small cell lung cancer for the remaining 20%. So lung cancer is by far the leading cause of cancer death among both men and women. So each year, more people die of lung cancer than of colon, breast and prostate cancers combined. So lung cancer occurs most often in older people. About 2 out of 3 patients diagnosed with lung cancer are 65 or older. Less than 2% are younger than 45. So most lung cancers do not cause any symptoms until they have spread. The most common symptoms of lung cancer are a cough that does not go away or gets worse, coughing up blood, chest pain that is often worse with deep breathing, coughing or laughing, hoarseness, weight loss and loss of appetite, shortness of breath, or feeling tired or weak. So these symptoms can also be because of other reasons than lung cancer. So one of the leading lung cancer causes is emotional stress. So Dr. Hammer is the founder of German New Medicine. So he developed testicular cancer a few months after his son Dirk died. So since he was never ill, he wondered if his cancer had to do with the tragic loss of his son. So at this point in his life, Dr. Hammer worked at a cancer clinic in Munich in Germany. So he wanted to know if the patients also experienced an emotional shock before they got cancer. So Dr. Hammer obtained brain scans of all his cancer patients. He then compared the CT scan with the patient's medical records and history. All his patients experienced an unexpected shock before cancer diagnosis. So Hammer discovered that a particular area of the brain controls a specific organ. So each conflict shock affects a unique part of the brain that relates it to the organ. So every cancer has a distinct conflict shock. So for example, he noticed that breast cancer is a consequence of a separation conflict, or that a cervical cancer is the result of a sexual conflict. Dr. Hammer found out that a disease runs in 2 phases. We have the active conflict phase that activates the moment we have the shock, and at the moment we resolve that conflict, we enter the healing phase. In this state, the tumor stops growing and decomposes. So cancer is not a disease, but rather a biological conflict. So our bodies go into fight or flight mode if there is an immediate danger. So the danger causes a specific physiological response. So animals also experience biological conflicts when an opponent attacks them. So humans and animals respond to unexpected distress biologically. Biological conflicts that humans and animals share include anger in the territory, worries in the nest, abandonment from the pack, separation from a mate, loss of an offspring and more. So the difference between humans and animals is that humans can think. Our bodies can't see the difference between a thought or a real situation. For us, a disturbing remark can cause an attack conflict. An unwanted move can create a territorial loss struggle. If we lose our income, then that can trigger a starvation conflict, and so forth. So when we experience a specific emotional struggle, it activates a particular biological response. So it's not the situation that causes the shock, but our perception of it. So every conflict shock is individual. So one person may experience a separation conflict. The same situation can trigger another response in the next person. And for a third person, the stress is trivial. It depends on our beliefs, values, or our vulnerabilities. So this is what Dr. Hamer noticed about lung cancer. So there are several types of lung cancer. The first type of lung cancer program is a bronchial carcinoma. Bronchi are the main pathway into the lungs. The bronchi become smaller the closer they get to the lung tissue and are then considered bronchioles. Both the bronchi and bronchioles carry air into the lung alveoli. The biological conflict linked to the bronchiole is a male territorial fear struggle, or in a female it is because of a scare-fright conflict. A territorial fear conflict refers to a threat to the territory. By territory I mean at home, work, in a senior home, hospital, or in the village, city and country where one lives. It can also be due to fear of one's safety as well as the safety of the pack. So physical abuse, family violence or bullying can trigger this fear. Or an accident, fire, flooding or a frightening diagnosis can also provoke this response. So a natural disaster, war or a terrorist attack can also scare you to death. The purpose of the biological conflict is to widen the bronchi to increase the oxygen intake. The second type of cancer of the lungs is alveolar lung cancer. Alveoli are tiny air sacs at the end of the bronchioles in the lungs. Alveoli are where the lungs and the bloodstream exchange carbon dioxide and oxygen. So the biological conflict linked to the lung alveoli is a death fright conflict. A death fright happens when we fear for our own life, or we worry about the life of others, such as a family member, beloved friend, or a pet. You can experience this death fright in any life-threatening situation. It can trigger in an accident. By far the most common death fright conflict is a diagnosis shock. A cancer diagnosis can feel like a death sentence. Learning that the cancer is malignant, inoperable, aggressive, invasive can scare the patients. Or if the doctor says that you have 6 months to live, then that can trigger a death panic. The same holds true for medical checkups. Pap tests, PSA tests, mammograms, colonoscopies, blood tests may freak the patients out. Or we can trigger this death panic if we have symptoms that may seem like cancer. If you have a lump in your breast or blood in the stool, then that can trigger a self-diagnosis shock. Pleural carcinoma is the third type of lung cancer program in the body. The biological conflict linked to the pleura is an attack conflict. It's especially an assault against the chest. An attack against the chest or torso can be a blow, stab or hit against the chest or ribs. You can experience this attack during a fight, accident or in sports. Accusations directed at someone can also cause an attack conflict. Also, surgery and other aggressive treatments may trigger attack conflicts. The biological purpose of the cell increase is to protect the chest against further attacks. So let me share an example of a lung cancer case. So the former Beatle member George Harrison died of lung cancer in 2001. So Harrison experienced a death fright 2 years before his death. On the 30th of December 1999, a psychopath attacked Harrison and his wife at their home. So Michael Abram, a fan, broke in and attacked Harrison with a kitchen knife. So he believed he was on a mission from God to kill the pop star. So Abram punctured George's lung and caused him severe damage before the police stopped him. So in the hospital, Harrison recovered from 40 stab wounds from the attack. So Harrison said in the Guardian article that there was a time during this violent struggle that I truly believed I was dying. So this situation triggered a death threat response, which may have led to the growth of his lung cancer. So if you struggle with lung cancer, then it's vital that you address your death fear. You can download this workbook to learn ways to stop worrying about death. So the link is in the description. Smoking is another risk factor for getting lung cancer. Tobacco smoke contains many chemicals that are harmful to both smokers and non-smokers. Cigarettes also increase the risk of at least 13 other cancers. Of the more than 7,000 chemicals in tobacco smoke, at least 250 are harmful, and 69 of the chemicals in cigarettes can cause cancer. Other lung cancer risk factors include asbestos. Asbestos fibers are durable and resistant to heat and do not conduct electricity. As a result, asbestos was a favorite insulating material since ancient times, so it was common in factories, schools, homes, and more. In the 20th century, growing evidence showed that asbestos damaged the lungs. Asbestos-related cancers became better recognized in the second half of the 20th century, so there has been a dramatic decrease in using asbestos in the United States since the mid-1970s. As a result, asbestos exposure dropped. However, it's still present in some products and older buildings. The European Union banned asbestos since 2005, but the ban did not require removal of asbestos that was already in place. Still, heavy asbestos use continues in some countries. Today I talked about different lung cancer causes. There are two main types of lung cancers: non-small cell lung cancer and small cell lung cancer. Lung cancer is by far the leading cause of cancer death among both men and women. So each year, more people die of lung cancer than of colon, breast and prostate cancers combined. The biological conflict linked to the bronchial is a male territorial fear struggle, or in a female it's because of a scare-fright conflict. Lung alveoli cancer is a death-fright conflict. The biological conflict linked to the pleura is an attack conflict. It's especially an assault against the chest. Smoking is another risk factor for getting lung cancer. Other lung cancer risk factors include asbestos. I hope you learned that there are natural remedies that you can use to prevent lung cancer. Download this workbook for free to learn how to release your death fear. The link is in the description. If you enjoyed this video, then press the like button and subscribe to the channel. Share this video on social media with your families or friends. Please visit our blog at cancerreason.net to learn non-toxic ways to treat cancer. You can also download more free documents in our free resource library. Thanks for watching, and I'll see you soon.